it's Mary Brownlee, licensed professional counselor. Today we're going to talk about the 4 different subtypes of borderline personality disorder. We're also going to talk about where these subtypes came from. We're going to describe the differences between them and also tell you a little bit about healing from borderline personality disorder at the end. It's important to mention that these subtypes are not like distinct categories where, say, for example, you can only fit into one category. No, actually, people can have kind of a blend of the different subtypes. Subtypes can change and evolve over time as the person ages. And so think of this as kind of a general overview of what some of the different types can look like, but they're not rigid, set in stone categories. And people can show, symptoms of some of the different subtypes together as well. I also wanted to add, it's super important to me as a trauma therapist to stop for a moment and use compassion to describe this disorder. About 30% of my caseload, if not more, at any given time is people with borderline personality disorder. So I want the average public to know that this is a highly stigmatized disorder, even in the mental health field. But I'm not one of those mental health professionals that stigmatize this disorder. I see every individual as a unique person. They all represent different shades of the disorder. So you won't see 2 individuals with borderline personality disorder having the same exact symptoms. So there will be difference in temperament or personality or how they interact with other people. You might see one that's more avoidant, one that's more clingy. You might see one that's more rage-filled, maybe one that's more quiet, and other people don't really notice the symptoms all that much. So that's really what these 4 subtypes are getting at. There's different shades to the actual main borderline diagnosis, and no 2 individuals are the same. But more importantly, these individuals suffer greatly. There's a lot of shame and self-hatred, a lack of identity, a lack of purpose and meaning. And so these individuals, suffer to a great degree. And so I, as a trauma therapist, I don't want this conversation to be harmful to anybody with BPD either, because I look at every individual with BPD as a human being first and foremost, who's very likely, in fact, every borderline client I've had has significant childhood trauma. So I wanted to make sure to get this important piece in there as well, since this is such a delicate topic, quite frankly, especially in the trauma community and the mental health community. And before we dive into the 4 different subtypes, I wanted to just give a very brief overview of how I conceptualize and treat borderline personality disorder. I use IFS, Internal Family Systems Therapy. I will link below additional videos that go into much more depth if you're interested in learning more about this approach. But essentially, in a nutshell, IFS teaches that we all have authentic self and wounded parts. So if we had grown up in a healthy, loving, safe family, we would not develop the degree and intensity and distress of wounded parts that you'll see in borderline clients. Instead, you would have like a strong sense of self that would be able to drive the bus, as I say, drive the bus of your life, for example. But instead, what borderline clients and other traumatized individuals often have is a significant and high degree of wounded parts that operate to keep them safe and to keep emotional distress at bay. So when I work with clients, I love IFS because it's so non-stigmatizing and it reduces shame. We're talking about parts, maybe parts that rage, parts that avoid, parts that are impulsive, parts that feel desperate to be loved, parts that cling, parts that push away. So I use that type of language, and it's a language that my borderline and other traumatized clients can easily grasp, and it feels really safe to them to talk about their symptoms in terms of these are just parts. They're not authentically you, they're just parts that have been there for a long time trying to keep you safe and helped you survive. So feel free to check the description below. I go into a lot more detail about IFS. It's a passion of mine. I love using this approach with my clients. All right, so borderline personality disorder happens when individuals experience long-lasting changes in how they perceive themselves, their identity, emotion regulation. They have difficulty with controlling mood and also with their behavior. They often face difficulties in their relationships, including high degree of distress, and oftentimes lots of conflict with those who are closest to them. Again, there are 4 subtypes, which we will go over shortly. And it's important to note that the severity can vary. You can have very high functioning individuals where the average person may have no idea they have BPD, or lower functioning individuals that, for example, might have a high degree of distress and symptoms that are very easily apparent in terms of maybe they're explosive or very manipulative or have a lot of problematic traits in their relationships. And as I mentioned earlier, it's possible to have more than one subtype, and these subtypes can change over time. They can evolve, they can get better, and BPD absolutely can be healed. I use IFS, as I mentioned, and clients oftentimes experience a lot deeper depth of healing with this approach than maybe with some others. So the subtypes have come from Theodore Milan, and he is an expert in personality disorders. And his book here, Disorders of Personality, DSM-4 and Beyond, is a very famous book where he goes into the subtypes. So feel free to check that out too if you want the actual professional who created these subtypes, his very thorough explanation of these four subtypes. So, there are a variety of opinions on what causes borderline personality disorder, but overall, what the research shows us is that there is a genetic component paired with environment. So, twin studies have shown a genetic link, basically, identical twins having a higher incidence of borderline together as opposed to maybe just siblings who don't share identical genetics. Also, childhood trauma is a very big leading cause of BPD, parental abuse and neglect when people are children. There's also brain differences that have been discovered. So these are areas related to like emotion regulation and mood, aggression, and impulsivity. So those areas of the brain show changes compared to somebody who doesn't have BPD, and also brain chemicals, specifically serotonin, which is responsible for helping our mood stabilize. These are not functioning properly either in those with borderline personality disorder. And, in my perspective, what I have seen in all of my borderline clients is extensive childhood abuse and trauma. So that's what I've personally seen. And again, I've been in the field about 9 years, thousands of clients over the years, about 30+% of my caseload of BPD clients, and not a single one of them has ever come from a happy childhood. So my guess is, even if you have a genetic propensity that might predispose you to some of the mood changes and impulsivity and whatnot, my guess is that the abusive childhood flips the switch on if you do have a genetic propensity. And I imagine you could probably develop BPD without any genetic propensity either, just from extensive abuse in childhood. So very likely, essentially, it's a combination of both. And of course, we know from the research too that abuse and trauma in childhood can also change the brain structures and also alter our chemical makeup of our brain. So chicken or egg doesn't really matter. It's a combination of both for sure. And yeah, so hopefully this is a helpful explanation. So, quiet BPD is the first subtype. This can really be seen as anger turned inwards at the person's self. They can be very high functioning. They can be very successful at their careers, for example, and high functioning, as in, a lot of those externalizing symptoms you might be able to see on the outside are not really present. Maybe the average person would never know that they had BPD, for example. They can fly under the radar. Again, the symptoms are not obvious to others, and their relationships are the source of their identity. They feel depression and powerlessness often, and they oftentimes are codependent and present as needy or clingy. They depend too much on other people for their happiness and their identity. And again, the anger is turned inwards at themselves instead of exploding at other people. So BPD, oftentimes the stigma is that, they're very explosive and volatile and constantly screaming at others. That's not always the case. This is the quiet version where it's very much they turn their anger inwards and you're not necessarily going to see it. They tend to be loyal, submissive, humble, and more vulnerable. And they oftentimes are over controlling. So again, IFS, they have over controlling parts that help them to suppress their emotions, help them to stay safe, and they can appear reserved and calm to other people. So impulsive BPD is the second subtype. These individuals are often highly impulsive. They engage in risky behaviors, for example, spending sprees or risky sexual behaviors, substance abuse, for example. They're more impulsive. And their impulsiveness serves to get their needs met. It's like immediate gratification, basically, that helps them to either connect with other people, receive attention, or again, just to maybe numb emotions, for example, with substance use. Their impulsive behaviors, for example, are oftentimes thrill-seeking behaviors, like speeding, driving that's unsafe, for example. They're also more prone to anger and feeling empty. So they will engage in more conflict behaviors. You'll see them more likely fighting and being volatile and having physical altercations with other people, lots of arguments and yelling. They're very, very highly emotionally reactive, and this often results from a volatile home life as kids. So this subtype very much, when they were children, had a volatile, scary household. And to other people, at least, they can appear flirtatious and charismatic at first as well. Petulant BPD is the third subtype. This is where somebody engages in a lot of passive aggressive behaviors. So, for example, they're not expressing anger directly at other people like the more volatile subtypes. Instead, it's more in an indirect fashion, passive aggressive behaviors, for example. Although they can explode at other people occasionally when they don't get their needs met as well. They can come across as negative and stubborn and demanding and impatient, not exactly the easiest people to be around. They also commonly demonstrate a pessimistic attitude about life and other people. They're resentful if other people they know around them are happy. And oftentimes this one comes from more of a neglectful childhood. So they didn't get their emotional needs met as a child. And so this neglect from childhood fuels this kind of anger and resentment. And they have a high degree of anxiety and irritability as well. And they use emotional manipulation to get their needs met. And they can take things too personally. They're easily slighted, too sensitive and prickly, so to speak. And they can be prone to feeling suspicious of other people's motivations. And again, this all makes sense if you consider the childhood trauma exposure, that they have developed suspicious parts and parts that feel lots of anxiety about life and other people's motives and not feeling safe. Self-destructive BPD is the last and fourth subtype. This is really, again, where they direct their emotions and feelings inward at themselves in a very self-destructive way. You'll see lots of self-harm here, greater suicidal risk. And there's more of this push-pull. They want to be around other people and have other people in their lives, but they also want simultaneously to be independent. And so you'll see more of a push-pull in the relationship. Like, I need you, and yet that kind of terrifies me, and I'd rather just avoid people and be independent as well. They want to keep other people happy. So oftentimes they are very compliant. But again, this also leads to a high degree of resentment. They're not getting their needs met. And then also depression can follow that. They tend to be moody, bitter, they hate themselves. And again, as I mentioned, a higher degree of suicidality, which is really dangerous in this subtype. So as mentioned, I will have a longer video available. In fact, it's already up on my channel, and I'll link it below if you're interested in a very detailed overview of healing from BPD. But in summary, I use IFS I love the idea of talking about all the borderline symptoms as just wounded parts that are trying to help the client survive and get their needs met. And also teaching them about self and what self energy is. Self is not a wounded part. Self has the ability to feel calm and centered and connected to other people. Self has wisdom and courage, and it's just this beautiful, calm energy. That's our authentic self. So, wounded parts are full of extreme emotions and extreme behaviors. And again, they're there to try to help the system survive. They've been there since we were kids, and they're just doing their best. They're doing their best to get our needs met, and they're not at all attempting to harm people on purpose, for example. So a lot of these are the triggers, the knee-jerk reactions, etc. These are explained better with IFS in terms of firefighter parts and manager parts. And for example, firefighter parts are the very extreme parts that you'll see, the volatile, super angry, super self-destructive, suicidal type of behaviors. Those are firefighter parts. So again, the video that I'll link below goes into great detail about some of these different parts. And essentially, IFS is all about us reducing the activity of the wounded parts, getting back in touch with who they authentically really are, and letting self drive the bus, because self is not going to harm them. It's not going to cause them to want to kill themselves. And self has the capacity to lead the entire system with courage and compassion, and also to connect to other people in a healthy way. So yeah, self-compassion here is really key to healing borderline personality disorder. So I hope you found my video helpful. I enjoyed teaching on this topic. Please drop a comment below if you have any questions. I'll be happy to try and answer them. And please leave a like and subscribe if you found this video helpful and you like the content and want more of this. And I so appreciate all of your support. And I hope you all have a wonderful day, and I look forward to seeing you in the next video.